Hi, my name is Jessica, and I had two-stage breast reconstruction surgery with Natrelle 410. During my last semester in college, my doctor found that I had bilateral breast cancer and needed a double mastectomy. My doctor and I decided that the best choice for me was two-stage breast reconstruction. After my mastectomy, the surgeon inserted Natrelle 133 tissue expanders to stretch my tissue to prepare for getting Natrelle 410 breast implants. I just got my Natrelle 410 implants 2 weeks ago, and they feel amazing. It's so nice to finally have them, and they came out better than I expected. I'm so happy, I'm so comfortable, I feel much more like myself, and it's a big weight lifted off my shoulders. It's so nice. Drawing and art is always a way that I've been able to express myself. It's really nice to go into a different world. It's so engaging, and it really puts me in this state where it's just me and the paper and the subject, and I get to create something that wasn't there before and make something that I really truly love. I'd like to tell other women going through this that breast reconstruction has come a long way. There are many advancements that will help you get through this. The journey might require some sacrifices, but once it's over, you can get back to your life and the things you love to do. Just remember, try to focus on the positive.
Natrelle breast implants. Important information. Who may get breast implants? Indications. Natrelle breast implants are indicated for women for the following: breast reconstruction. Breast reconstruction includes primary reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. Breast reconstruction also includes revision surgery to correct or improve the result of a primary breast reconstruction surgery. Important safety information. Who should not get breast implants? Contraindications. Women with active infection anywhere in their body. Women with existing cancer or precancer of their breasts who have not received adequate treatment for those conditions. Women who are currently pregnant or nursing. What else should I consider? Warnings. Breast implants are not lifetime devices and not necessarily a one-time surgery. Many of the changes to your breasts following implantation cannot be undone. If you later choose to have your implants removed and not replaced, you may experience unacceptable dimpling, puckering, wrinkling, or other cosmetic changes of the breast which may be permanent. Breast implants may affect your ability to breastfeed either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent and may not be detected by you or your doctor. You should have an MRI 3 years after your surgery and then every 2 years after that for as long as you have your breast implants to determine if rupture is present. If implant rupture is noted on an MRI, you should have the implant removed with or without replacement. With breast implants, a routine screening mammography and self-examinations for breast cancer will be more difficult. Ask your doctor to help you distinguish the implant from your breast tissue. Symptoms of a ruptured implant may be hard knots or lumps surrounding the implant or in the armpit, change or loss of size or shape of the breast or implant, pain, tingling, swelling, numbness, burning, or hardening. Tell your doctor of these symptoms and remove ruptured implants. Inform any doctor who treats you of the presence of your implants to minimize the risk of damage to the implants. What type of conditions require more study? Precautions. Caution: notify your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, for example, lupus and scleroderma. A weakened immune system, for example, currently taking drugs that weaken the body's natural resistance to disease. Planned chemotherapy following breast implant placement. Planned radiation therapy to the breast following breast implant placement. Conditions that interfere with wound healing and blood clotting. Reduced blood supply to breast tissue. Clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Please discuss any history of mental health disorders with your surgeon prior to surgery. Patients with a diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What are some complications with breast implants? Complications. Key complications are reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and severe capsular contracture, severe scar tissue around the implant. Other complications include asymmetry, nipple, breast, skin sensation changes, scarring or wrinkling, rippling. Talk to your doctor about other complications. Talk to your doctor. For more information, see the patient brochures at www.allergan.com/labeling/usa.htm or call the Allergan Product Support Line at 1-800-433-8871. To report a problem with Natrelle, please call Allergan Product Surveillance at 1-800-624-4261. Natrelle breast implants are available by prescription only. Natrelle 133 tissue expanders. Important information. Approved uses. Natrelle 133 tissue expanders are approved for breast reconstruction following mastectomy, treatment of underdeveloped breasts, and treatment of soft tissue deformities. Important safety information. Who should not get tissue expanders? Do not use if you already have implanted devices that would be affected by a magnetic field, have tissue unsuitable for expansion, have an active infection or residual gross tumor at the expansion site, are undergoing adjuvant radiation therapy, have a physiological condition, example obesity, smoking, diabetes, autoimmune disease, hypertension, chronic lung or severe cardiovascular disease or osteogenesis imperfecta, or use certain drugs, including those that interfere with blood clotting or affect tissue viability, that may result in a high risk of surgical and/or postoperative complications. What else should I consider? Natrelle 133 tissue expanders should not be used in patients who already have implanted devices that would be affected by a magnetic field. Active infection anywhere may increase risk of infection around the tissue expander. Certain infections may require premature removal of the device. Natrelle 133 tissue expanders are temporary devices and are not to be used for permanent implantation or beyond 6 months. Tissue expansion in breast reconstruction typically requires 4 to 6 months. What are possible complications? Deflation, tissue damage, and/or appearance of the implant through the skin, infection, unwanted shape, unintended blood or fluid collection, capsular contracture, tightening of scar tissue that causes the breast to harden, premature device removal, bone, pain, sensation changes, and inflammation. To report a problem with Natrelle, please call Allergan Product Surveillance at 1-800-624-4261. For more information, please visit www.allergan.com/labeling/usa.htm or call the Allergan Product Support Line at 1-800-433-8871. Natrelle 133 tissue expanders are available by prescription only.